And Health Tonight, we are on flu watch, as we are every year this time of year. The CDC says doctor visits for the flu right now have hit their highest level in nearly 30 years. The rise in cases also includes new strains of the flu. CDC says since October 1st, there have been at least 120,000 hospitalizations around the country from the flu, at least 5,000 deaths, and that does include at least 9 children. This is not the only concern, I can tell you, that we're watching tonight. We're joined by Dr. Deepika Kumaresan with Baylor Scott & White. Talk to us, first of all, about what trends you're seeing in your practice. And when I say that, if you can give kind of global with COVID-19, flu, RSV, all of it together, what are you seeing?
Absolutely. So we are seeing an uptick in especially flu this season and RSV. And of course, there's COVID in the background. We are seeing concurrent infections with COVID as well, but we do see a lot of flu cases this year.
And the COVID, just to state it out loud, the COVID thing, it's here to stay, right? It'll keep coming back around, morphing in different ways. And so we're seeing an uptick in respiratory illnesses, and I want to address that a little bit. How can families differentiate? And this is one thing in my own house. Do I have RSV? Do I have flu? Do I have COVID-19 symptoms? How do we begin to separate one from the other? Because honestly, they all look and feel the same sometimes.
Yes. Let's keep it simple. So if you're having high fevers and severe body aches and pains, we are leaning towards the flu. Okay.
Makes sense.
So RSV can be tricky. You know, it can present with severe respiratory issues, especially in children and older adults.
And let me pause you there, because I remember with my daughter Maddie, who's now 23, but I remember when she was like maybe 2 or 3 years old, RSV was like a thing, and it was kids.
Yes.
But it's no longer just kids, but usually more prevalent with kids. Is that what you're saying?
Yes, more prevalent with kids and geriatric population.
Okay.
They get hit the most, and we do have antibodies for the children, you know, and we do have vaccines for the geriatric
And just
population.
to finish that, symptomatically COVID, now, whatever's going around right now, whatever strain of it, what does that feel like in the body?
Oh gosh, you know, that's another spectrum. It can be very mild. We have cases who feel like they just got some common cold, but then we have very severe cases. We see them in the hospital, but more or less they do seem to have loss of taste and smell. That's kind of leaning towards your COVID infection. Otherwise, the body aches and pains and the fever, all other symptoms, they are very basic. It kind of goes well with all the respiratory illnesses.
Okay. So this is the part where I don't have to slide my credit card and do my copay. We get free advice from the doctor without the copay tonight. What steps can all of us, families, take to protect against the viruses? And and realizing some people are okay wearing masks, a lot of people don't want to wear them. We don't want to get into the political side of it. What else besides masking can we do?
Gotcha. So flu shots, it does prevent. We do have studies showing that it prevents from severe infections and hospitalization. So it's your chance, get your flu shot. Another thing is keep your hand hygiene in the highest priority, and wipe down the surfaces where you have touched, and stay away from sick patients if you know that if someone is sick. And also, if when you are sick, please stay home. Protect your loved ones.
And that's different today. And we're all living in this different society where 20 years ago, if you were sick as a dog, you still show up to work. You know what I mean? There was that mentality. Today, especially since COVID, oh, you don't feel well? I don't even want to see you at the office, which is better thinking, I would think, right?
Definitely. Please stay home. Take that couple of days off and save a lot of heartache for the company, because many of them are going to take off if you go to work. Because it's coming. It spreads real fast.
When we do want to go see a doctor, and maybe this relates to you watching right now, especially with respiratory symptoms, at what point do I say, okay, now's the time that I need to go see the doctor if I'm just not feeling real well with the respiratory side?
So if you're not able to keep any fluids down and you have persistent high fevers, and
can you define persistent? Is that half a day? Is that 2 days? What is that? What does that mean?
You have taken your antipyretics, your Tylenol, and still your fever is not reducing. You are keeping up with your antipyretics, but still you're not seeing any change, or it's getting worse. And you're not able to keep your fluids down,
Okay.
and you can see signs of dehydration, like your lips are parched, and you can tell. You look at your oral cavity, go to a mirror, look inside your mouth and see how hydrated you are, and look at the turgor of your skin. That's another way we can tell. Especially in children, you know. So see how you feel. If things are escalating real fast, it's your cue to contact your healthcare provider or go to the urgent care or ER. Whatever is feasible for you at that time. This is very important because we can prevent severe consequences of these infections if we catch it early on.
Okay, any new treatments in your world for RSV or flu this season?
Well, as usual, we have the flu shots, and we do have RSV antibodies for younger children. Okay.
And is that an infusion? What is that?
It's a antibody treatment. Yes,
okay.
and you have to see if you're eligible. There's a lot of caveat behind that. Right. You have to ask your PCP to find out if you're eligible.
I'll save you the frustration. I read that as insurance. Yeah, we got to figure it out.
Yes.
Okay, but there is some stuff out there available.
Yes, and we do have RSV vaccine for geriatric population, and that's a great way to prevent severe infections. Yes.
Good idea. Dr. Kumaresan, thank you again for being here.
Absolutely.
As always, look at that. No copay, free, just for you. You'll be able, by the way, to find this conversation and others. We do a lot of them with our partners. Ion Health segments on our CBS News Texas YouTube page. See, you're YouTube famous now, too. That's a big deal.